Good evening, ma'am. Am I audible to you, ma'am?
Yes, doctor.
Respected participants, due to the technical issue, we are just starting late. Welcome back to the today's session. Warm greetings, everyone. Today, our speaker's ma'am name is Shanthi Narayanan, ma'am. Ma'am is a professor in the Department of Organ of Medicine from Vinayaka Mission Homeopathy Medical College and Hospital. We welcome you, ma'am. We welcome you. Session is yours. Thank you, ma'am.
Thank you, doctor. I hope my voice is audible to everyone, and I'm really sorry for the inconvenience held up. So, to start with the concept of disease in homeopathy, uh, audience, I doesn't know who all have participated, but still, any students are there, please have your organ on text side by you, and please mark the points what I'm saying. So it will be helpful for you guys too. Yes. Yes, coming to the definition of disease in homeopathy, you all know, according to Samuel Hahnemann, disease he defines in aphorism 9 and in aphorism 11. So why I am stating this, because without knowing alphabets, you can't go for a word, then you have to learn a sentence. So basically, the definition of disease in homeopathy, according to Hahnemann, he explains in aphorism 9 and 11. And also, you should know, please take up the aphorism 9 so that I'll give you the key points of aphorism 9. Why? Because our seminar today is regarding the concept of disease in homeopathy, not cure, right? So, how does the disease as per the perspective of Samuel Hahnemann? So, we all know that aphorism 9 is regarding vital force, right? So, you must be, as it is a memorizing aphorism, you must be knowing about the aphorism 9, where the healthy condition of man, the spiritual vital force, what you call it as autocracy, that dynamics that animates the material body, that is our body organism, rules with unbounded sway and retains all the parts of the organism in. So when this vital force is the parts of the organism is admirable, harmonious and vital operation, please underline those things: admirable, harmonious and vital operation as regards both sensation and functions, so that our indulging reason gifted mind can freely employ this living. For what? Actually, for the higher purpose of our existence, right? So Hahnemann explains about the disease condition occurs when the vital force is getting deranged. So simple concept of disease according to Hahnemann is given in aphorism 9. So, well, he follows it with aphorism 11. He explains that diseases are not entities with independent existence, but alterations in the condition of the vital force. So, he'll say that derangement of vital force. He explains in aphorism 11, right? So, where he uses the term dynamic. So the dynamic influence, the dynamic is which could not be seen, something spiritual. So that dynamic power, what we call it as the vital force, right? So I hope you understood the definition of disease in homeopathy. What Hahnemann talks about in aphorism 9 and 11 is that alterations in the condition of the vital force leads to disease condition. Hope I am clear, right? So coming to the importance of understanding disease from a holistic perspective. So being a homeopathy doctor, you should understand that disease is a holistic perspective. So understanding the disease, how? Because it is a cornerstone to homeopathic philosophy, as it emphasizes treating a person as a whole rather than focusing solely on the isolated symptoms. That is a specific symptoms particular to a part of a body, right? Instead, Hahnemann's organon of medicine provides insight into the comprehensive, especially in aphorisms 6, 9, and 18. So, please again refer your textbook of aphorism 6, 9, and 18. So, aphorism 6, hope you must be knowing about the unprejudiced observer, right? Where Hahnemann talks about morbid phenomena, accidents, and symptoms, right? Except the changes in the health of the body and the mind, where he has described about the morbid phenomena, accidents, and symptoms, which can be perceived externally by means of the senses. So see how intellectual physician he is, right? So in aphorism 6, when he talks about an unprejudiced observer, he talks about the to thee be the powers of penetration ever so great, takes a note of everything in every individual disease condition. So according to Hahnemann, every physician should take a note of individual diseases, except the changes in the health of the body and the mind. So he talks about the morbid phenomena, accident, and symptoms. So here the accident means the cause and the symptoms mean the pain what the person is feeling, the patients are feeling. So altogether, you should portray the disease condition so that a law of similimum is replaced and given an indicated similimum here, right? So in aphorism 9 again, he talks about vital force in health, how it is, right? So where in aphorism 9 again with the vital force, what it is doing, that memorizing aphorism of regarding both sensation and functions are affected, right? That indwelling reason gifted mind can freely employ this living. So when the vital force is getting deranged or some alterations are made or whether our sensations are altered, higher purposes of our existence is getting disturbed, right? So how clearly he portrays the importance of understanding diseases from a holistic perspective. So these of our are the choice, sole guide. So the choice of the remedy, the sole guide, he says, from his indubitable truth, means without any doubt that besides the totality of symptoms, okay, nothing can by any means be discovered in disease wherewith they could express their need of aid. It follows undeniable. Undeniable means something true, which is solid, that the sum of all symptoms, right? Sum of all symptoms in each individual case of disease must be the sole indication to sole guide to direct us in the choice of a remedy. See how he is explaining in the aphorism. It is something like eating halwa, right? So we all taste that halwa. He is giving the importance of symptoms, right? Sum of all the symptoms in each individual case of a disease must be the sole indication. So main part of it is the sum of all symptoms, where he talks about the totality too, right? The sole guide to direct, then only you can go for the choice of a remedy, right? So he clearly explains. So understanding disease from a holistic perspective, though it is a cornerstone of homeopathic philosophy, he says treating the person as a whole rather than focusing on a particular symptom. He explains in aphorism 6, 9, and 18 very clearly how what makes the disease condition concept of homeopathy here, right? So this is an, he uses the term undeniable, something true. Henneman is always sticking to this word. Why so? Because even Metra Medica is given as Metra Medica Pura, because the symptoms what he has collected is so pure. Okay. So here, true logical, Okay, that is to inductive logic. So there is a fact in everything what he has said. So all these aphorisms you will have to remind in your memory while practicing. Okay. So I have told about these examples, but I'll give you a case regarding this because as practitioners, as physicians, more than theoretical, you need to go for a practical also, right? I'll tell you about a case. A woman of 35 years old through. So we'll be writing in the history of presenting complaints that the patient has taken allopathic treatment but gave only a temporary relief, right? Then we'll say he a patient has came to our OPD for further treatment, right? Through the holistic case taking, I discovered that she recently went through a divorce, has a high stressful job, and often feels lonely and unsupported. She's left alone at home, right? So she doesn't have a person to share her thoughts and feelings on, lean to a shoulder who will support her and give her words of comfort. So here the holistic approach is being an organon teacher. What I felt was her emotional state, her lifestyle, mental symptoms alongside her physical complaints. The remedy selected addressed her anxiety, loneliness, stress, as well as the physical symptoms. The prescription was Natramure, which aligns with her emotional vulnerability, sensitivity to grief, and physical symptoms. So, why this Natramure? Because though she is divorced, it was so of a silent grief, right? So, in her follow-ups after giving Natramure in 200 potency based on her susceptibility, right? I gave her 7 doses for 7 days, right? With along with SL taken at bedtime. And follow up over the time, the patient experiences relief from her headache and digestive issues, along with a gradual reduction in anxiety. See, what I am here to tell you is like the disease concept. What is it here? So I can consider her gastric complaints or her chronic headache, which has been for more than 6 months on and off, and recurring anxiety. What will happen next? So what I'm going to do further? So all these things has been these I can take, but holistic approach is entirely different in the perspective of a homeopath, right? So I hope you will accept with my thought. So here, her condition from a holistic perspective allows her vital force to regain balance. According to homeopath, as organon of medicine is our principal guide to treating diseases, we follow this holistic perspective, right? Leading to an improvement in her overall well-being, both physically and mentally. The patient was feeling better, and to be truthful, I received a gift box of Diwali sweets from her, right? So it is the credit what patient has given to me, right? So I felt happy, even if I earn 1,000 rupees for her consultation, that will be of not much happier. But receiving a box of sweets for Diwali and a note from her saying that, thank you, doctor, you relieved me from my headache and my anxiety of thoughts. I was feeling so happy and was flying. So I was telling to my husband that, see, this is homeopathy. So here comes the holistic perspective. Here, Samuel Hahnemann, founder of homeopathy. I need not tell you about the concept of vital force again in aphorism 9, 10, and 11. So really, I need to explain it in aphorism 10 and 11. So already hope you know about aphorism 9. Keep learning aphorism 9 daily. Why? Because not alone Metra Medica in our table, but this book of thought, Organon of Medicine, 5th and 6th edition together will give you valuable knowledge for each and every case. Each time you find it different while learning these aphorisms. So in aphorism 10, he'll be talking about vital force, which is capable of no sensation and no function, means absence of vital force he'll be talking about, right? So immaterial being, functions of life. When there is no function of life or no sensations, think about how the person will be. Again, in aphorism 11, vital force and disease, again, the derangement of vital force, what we discussed earlier, the dynamic. The word he was mentioning it as the dynamic power in the aphorism, right? So Henneman is really an intellectual physician, right? So dynamic effect of the sick making influences upon healthy man, as well as dynamic energy of medicines upon the principles of life in the restoration of health, is nothing else than infection. So not in any way material, not in any way mechanical. So this will be explained in the aphorism footnote of 11, right? So please go through all these aphorisms when this webinar is over. So coming to the next with examples, imbalance in vital force leading to disease. So why I'm discussing cases for these aphorisms? Because theory is entirely different while going for a practical cases. How do you relate aphorisms with practical cases? So I just wanted to know the concept of disease in homeopathy. So here, a 45-year-old man presents with chronic fatigue, irritability, and recurring stomach issues. Traditional medical test relief, no significant findings. For his stomach issues, he has gone through the endoscopy where his findings were normal. Yet he experiences ongoing discomfort. He reports feeling constantly stressed and emotionally burdened due to a demanding job and family responsibilities. So, see, 45-year-old man coming across nearly at the age of 50, demanding for a job. Think about a situation about running a family of with two children. So, hope you will understand. And moreover, being a male practitioner or a female practitioner, we all know the burden of a job and demanding for a job for family, right? So analysis with vital force concept in homeopathy, his symptoms are seen as expressions of a disturbed vital force. I do underline disturbed vital force rather than the physical ailments. Physical ailments like recurring stomach issues or irritability or his chronic fatigue. The imbalance in his vital force potentially triggered by prolonged stress and emotional strain. Being a man of 45-year-old with no paisa in hand, think about his situation. Definitely he'll get irritable when there is no even a rupees 10 in his pocket. Think about it. Males will really get irritated as manifested as both mental, so irritability, and physical stomach issues, fatigue symptoms. So you will have to understand the imbalance of vital force here, right? It is coming in the emotional strain as well as stomach issues. So a remedy such as Naxvomica might be selected based on the totality of symptoms. Again, Naxvomica, which was given at night, 207 doses, daily dose. Underlining imbalance. So how far did you give, ma'am? So that will be your next question, right? So most probably only 7 doses. Then following follow-up, he was bit relieved from his mental issues and few of his symptoms regarding to the stomach issues. Then later again, Naxvomica 200, 2 doses or 3 doses, alternative days I've given with much of SL. So I always use SL, Saclac, more than prescribing the medicine with minimum doses. And here, Naxvomica is known, yes, symptoms for underlying imbalance in this vital force, known for belonging individuals who are mentally overworked, irritable, and prone to digestive issues. So I hope this example would have related the imbalance in vital force causing the disease condition. Then coming to Hahnemann's focus on symptoms as expression of disease. So, according to Hahnemann, focus of symptoms as expression of disease. Of course, he talks about in aphorism 6, 7, 18, and 153. Again, please refer to your books. See, I am explaining you in what to say, very simple manner, because in UG level, if you understand all these concepts, for PG organon of medicine, you will have to compare it with many authors or many pioneers, right? So here in my PPT today, I have given only Kent philosophies related to this concept. So we have got only 1 hour. This is a very vast topic, and always organon of medicine takes time, right? So here aphorism 6. So hope you know aphorism 6 is regarding again obviously aphorism 7. Again he talks about the totality of symptoms, and here in the footnote Hahnemann always tells that intelligent physician, please note it down. So why? Because the intelligent physician would first remove this where it exists, the indisposition, thereupon generally case cease spontaneously, stops it. He will remove from the room strong smelling flowers, right? So these were the examples which was given. Okay, so it is in another 5 mark question too. So the primary, what does that intelligent physician do? All these things. So sticking to the point here, what he talks about in aphorism 7 is maintaining the cause occasionalis has to be removed. So he says that it is not necessary that every individual physician would first remove this where it exists. So you should be very cautious while treating the disease condition. Then in aphorism 18, he also explains about, see, again, we have told some of all symptoms, right? The sole indication and the sole guide. Then coming to aphorism 153, a beautiful aphorism written by Hahnemann is 153 aphorism. You know why? Because nowadays, what I do while practicing, 4 to 5 cases are there in my clinic. I stick on to aphorism 153. Why? Because I need only the characteristic symptom. Ma'am, is that correct? So Henneman has talked about the totality of symptom. Why do you go for 153 aphorism also? The question what you are thinking I could recall, but when the cases are more, you will have to handle sometimes like this. That is what I said. Theory is extremely different from practical, but always stick to the principles of Henneman so that you will have successful cases, right? So for some 153, again, he talks about the characteristic symptoms, right? So in search for a homeopathic specific remedy, that is to say, in the comparison of collective symptoms of the natural disease. How Superman. So disease, he says it is natural. The collective symptoms of the natural disease with a list of symptoms of known medicine. Of course, for each and every symptom, you have multiple choice of drug in order to find among these artificial morbific agent, right? So these morbific agent corresponding by similarly to the disease condition. So artificial morbific agent here is the medicine corresponding to the similarity of the disease condition to be cured. So always remember, the more striking, the more singular and common and peculiar characteristic signs and symptoms. I'll tell you one live example. Like once a patient visited my home. Okay, from there I took the case. I couldn't get that properly, and finally I arrived with 2 symptoms, whether it is pulsatilla or whether it is arsalpa. So I just was confused, not confused, confusion actually. So which is prior? So I need more clarity with the symptom. Suddenly, the patient bystander is her mother, and looking at my home dining table, she told, "Ma'am, this dining table looks absurd." So if it is at our home, my daughter will make it clean and clear. So one thing is, I felt so bad when she talked about my dining table was so ugly. But one thing, what to say? I was happy that I found out her medicine was Arsalb, right? Not Pulsatla. So that is what an observer or a physician needs. Okay, this is regarding 153 aphorism for peculiar characteristics, right? Not everybody of ourselves will desire have this fastidiousness. Okay, so see how it is relevant to aphorisms. Homeopaths can identify the remedy that corresponds more closely with the patient's condition. So finally, it is not like an unprejudiced observer. When the mother said the symptom, it just clicked my mind, right? For Hahnemann, treating diseases means addressing the imbalance at its root rather than suppressing symptoms. So that is why he has asked us to avoid the external applications. So external application is another beautiful topic to be dealt with, aiming to restore harmony in the whole person through the vital force. So when in PG, when I come across this suppression of symptoms, so from that day onwards till now, for the past 20, not 25 years, right? I completed my PG before 5 years. So I never use ointments before after completing UG. I was applying like giving medicine internally as well as externally. But here I stopped using after my PG, stopped using ointments. So I always stick to what Hahnemann has said, except in few chronic conditions and adamant diseases which cannot be cured. So aiming to restore harmony in the whole person through the vital force. So really, Hahnemann focusing symptoms as the expressions of diseases where there is an imbalance in vital force. Okay, I always stick to the vital force. Coming to Hahnemann's organon of medicine, again aphorism 9 and 11, concept of disease, he says, this is the foundation actually. Then comes the view of disease, theory of miasm, and importance of individualized treatment, where homeopathy stands one step up in the treatment because we people choose individualized treatment. Okay, these ideas collectively guide homeopathic practice, focusing on understanding the root cause of disease, recognizing inherited predispositions, and treating each patient as unique. So, each patient as unique. So, nowadays, do practitioners feel that? But homeopathy is really a boon. Concept of disease, aphorism 9 and 11 again, and miasms, aphorism 78 and 204. Please open up the book for aphorism 78 so that I could give you few points on that. So really today you will understand the concept of disease according to Hahnemann. So aphorism 78, Hahnemann will be talking about what? True miasmatic diseases, right? So in his classification of miasms, true miasmatic or chronic diseases, where there comes the real miasm. Okay, so in writing a case sheet, in the classification of disease, you will have to write whether it is a true miasmatic disease or artificially chronic disease or drug induced chronic disease. So under that, many of the disease conditions comes under this true chronic disease or miasmatic diseases, where they arise from a chronic miasm which when left to themselves are unchecked. Please note down the words what Hahnemann has used, left to themselves and unchecked by the employment of those remedies are specific for them for cure, always goes on increasing and growing worse, notwithstanding the best mental and corporal regimen. Corporal is bodily symptoms. And torment the patient to end of his life. Torment, na, what do you say is make him to suffer like anything, right? So think about it, taking medicines continuously or making them worse. Really so pathetic. Hanuman is a gentleman, I should say. That is why even homeopathic aggravation, a slight aggravation of the original symptoms present also he couldn't accept. That is why he founded 50 millismol scale potency in the 6th edition of Organon. See how genuine and gentle. We people prescribe medicine in larger doses, in heavier doses, what all. So think about Hahnemann, how gentle he was in prescribing. Okay. So here, notwithstanding the mental and corporeal regime, so are the most numerous and greatest soldiers of the human race, for the most robust constitution, the best regulated mode of living, and the most vigorous energy of the vital force are insufficient for their eradication. So really, we should eradicate. So during the flourishing years of youth, you doesn't have any disease condition, even though you have a robust constitution or what else, but the vital force remains normal. When you become aged, the vital force is getting deranged and the disease condition appears. So it is a beautiful aphorism 78. It is one of the chronic classifications of Hahnemann. And in aphorism 204, please take up the book and mark these words, because Hahnemann has talked about so genuinely here. He'll be saying that internal, right? The chronic miasms, internal syphilis, internal psychosis, and internal sora. So, with the development of these three chronic miasms, how these miasms has penetrated in it all directions before the appearance of the primary vicarious local symptom of each of them. So he says, for sora it is the scabious eruption, and for syphilis it is the chancre and bubo, or the bubo, and in psychosis the condylomata. So see about their outburst. Okay, chronic disease concept is given in this aphorism 204. Understand this first. Then you can go for other methods of practice. First, understanding Hahnemann's organon is a prime importance in practicing homeopathy. So here, aphorism 204, he talks about the irrational, persistent, harassing, and pernicious treatment of diseases, often only of trivial symptoms by physicians of old school, where he reminds us of the development of the three chronic miasm as internal syphilis, internal psychosis, and internal sora. So what a beautiful aphorism, right? So then coming again to the individualization of a treatment, again in aphorism 5 and 153. So I have already talked about aphorism 153, and coming to aphorism 5, you must be very well known about aphorism 5. Yes, what was that? He will be always talking about the individualization of a treatment in acute condition and a chronic condition. He says that exciting cause is necessary for every acute case, right? So for every acute case, you must find out the exciting cause. For every chronic case, you will have to find out the fundamental cause, because this fundamental cause is generally due to a chronic miasm. When we are writing case sheets in the disease classification and after the classification of miasm, what is the dominant miasm in that case, right? So that our prescription will be easier. So here, so if we follow these principles ditto according to the case taking, hope your prescription will be very easier. So you can pick out the medicine very boldly. So in aphorism 5, I need to tell you that Hahnemann talks about one more thing also in aphorism 5. So accessory symptoms of a disease condition. So concept of disease, not alone the exciting cause or the maintaining cause or this fundamental cause. Okay, but you'll have to look for his occupation, his moral, his intellectual character, mode of living and habits, his social and domestic relations, his age, sexual functions, etc., to be taken into consideration. So, see how Henneman shows the concept of disease, not alone the fundamental cause for a chronic disease and an exciting cause for an acute disease. Go for the accessory symptoms of the disease also. So it is beautifully explained in aphorism 5. So these concept understanding diseases as dynamic disturbances of the vital force, recognizing miasm as deep-seated cause of chronic illness. That is where in chronic diseases, Hahnemann talks about miasms, and individualized treatment form the foundation of homeopathic philosophy. Then comes the quote from Organon about disease being an expression of internal imbalance. So I always admire Organon of Medicine by Samuel Hahnemann, 5th and 6th edition together. So here, view of disease as an expression of internal imbalance can be found in aphorism 11. So already we have discussed about the vital force, right? So in that vital force, what is the derangement which was given? So the morbid derangement only makes it of those parts of the organism exposed to the sense of the observer and physician. So we should observe what has been wrong in it. A dynamic internal force that governs health. Disease is therefore an outward manifestation of the internal imbalance, right? With symptoms serving as a visible expressions of a deeper disruption in the vital force. So it shows little more deeper disruption in the vital force. Coming to the concept of miasms by Hahnemann. So again, explanation of miasms was given in aphorism 79 and 80, Sora, syphilis, psychosis. See, I'm telling you the concept of disease in a milder form. When you come to PG level, why I am talking about these are the basics to be understood first in the concept of disease, right? Then only you can move further with the philosophical explanations. So when we understand this concept, it is easy for practicing. So again in aphorism 79 and 8, please refer to the books. Aphorism 79, hope he'll be talking about syphilis and condylomata diseases, right? So he will say, till now, hitherto, he uses the word hitherto, till now. It has been so many years from the time of Hennemann, right? But still now it sticks to the point. Has been some extent known to such as the constituent miasmatic disease, which when uncured ceases only with the termination of life. So sometimes it just takes away the life. It's psychosis, syphilis, as well as the psychosis, what he call it as condylomata diseases. And in aphorism 80, he talks about the mother miasm, or else you call it as an universal miasm, Sora. So I need not explain to you all these things. So hope you know the chronic miasm of Sora. Yes, and also one thing, let me explain. I'm really urged to explain this. Why? Because normally a patient who's coming from skin complaint. So being doctors, we have seen many different types of skin complaints. But according to Hahnemann, see these words, underline these words. What is said for few vesicles accompanied by intolerable voluptuous tickling itch, right? So let me tell you, a person who is suffering from diabetes for the past 10 years, a lady, she told me, Madam, it is intolerably itching. See, my vaginal parts have been after itching. When being a doctor, when I had an observation with her vaginal parts, I could see how so, what to say, voluptuous, that word I could identify from the patient's skin, voluptuous tickling itch. She has been diabetic and urine. She has got 4 plus as urine. So continuously itching, itching, itching. She has got here and there few vesicles and itching, and sometimes there is little bit of bleeding also. Bleeding in the sense not pouring. So some sort of a skin reddish layer. Okay, she says it is so burning after the voluptuous itch. She was really extremely prostrated and weakened after this condition. So, Soranum was her medicine, Soranum 30 potency. Okay. Then later it was changed to 0 bar potency because we know that I needed to give her often the remedies. So, according to 50 millismol potencies, we can go for remedies. Not a single dose, we can go for multiple doses if necessary. Okay, more or few doses if necessary. So I chose 50 millismol for this condition. First, it was Soranum 30, then it was not Soranum, it was sulfur 0 bar 3, which was available with me. So according to Hahnemann, 50 millismol scale should be prescribed from 0 bar 1, right? From the least potency to the moderate potency. But as 0 bar 3 was available with me, I started with 0 bar 3. Okay. So that is what aphorism 80 is regarding that skin symptoms. See to the symptoms, how much the person suffers, the pain, and they'll be telling you like that. Doctor, I couldn't tolerate itching, so I left. And one of my patient is like, you comb your hair, right, with that comb. She uses to for itching. She used to scratch with a comb, and her both legs. Okay, it seems to be reddish and blackish. So she is also diabetic. Okay. So this pruritus, which is occurring in diabetes mellitus. So why I'm saying this, because you should understand the nature and the concept of disease. Okay. Then how miasms form the basis of chronic disease in homeopathy, explained from aphorisms. Aphorism 78. So miasms are the root cause of chronic diseases, where we have been talking about the true miasmatic diseases. And aphorism 204, the persistent of disease due to miasmatic influences. So 204, what we have discussed. In aphorism 206, the need to recognize and treat medicines, right? Treatment of a before commencing the treatment of a chronic disease, it is necessary to make the more careful investigation. Understood? Please underline those sentences. Why? Because in the investigation, see, he is telling you in the footnote also, in the investigation of this nature, we must not allow ourselves to be deceived by the assertions of the patients or their friends, who frequently assign as the cause of the chronic disease. So assigned cause. So patient by himself will be saying, or sometimes patient's bystander, his friends will be giving that. We should not get moved by those symptoms. And the severest and the most invertebrate diseases, either a cold caught, right, a fright, a sprain, everything explains. So the body develop chronic. So aphorism 206, along with the footnote, gives you need to recognize and treat the miasm so that the disease condition gets cured, not recovered. So these miasms foundational to chronic disease and represent inherited or acquired imbalances within the vital force that make individual susceptible to ongoing health issues. Hope I am clear that again and again we are sticking to the vital force imbalances causes disease condition, and being a physician and a person who studies organ will always relate to the derangement of vital force. So I hope 2 or 3 more slides. I hope so. I'm not boring with my class. So here James Taylor Kent. So you must be popular about Kent. So I want to tell a few words about influence on homeopathy disease theory, because 19th century prominent practitioner, right? He also said about the disease theory, right? By emphasizing the importance of understanding the disease condition as a disturbance in the vital force. What Hahnemann has said, he is also saying the same, and recognizing the interconnectedness of mind, body, and emotions in health. You all know. So, if you are a practitioner and if you are a student of homeopathy, you'll be knowing about Kent lectures as well as Kent repertory, where you have multiples of mental generals. Okay, even the final year students who learn repertory always sticks to Kent repertory. Why? Because generals are there. Okay, so here always connect James Taylor Kent with mind, body, and emotions in health. Kent expanded upon Hahnemann's idea, emphasizing that the totality of symptoms means mental, emotional, and physical all together should have a remedy selection. So, what he said is so true, following Hahnemann. He believed that disease was not just a local distribution but a systemic imbalance in the vital force, right? Left unrest would express the variety of symptoms. Kent philosophy of individualized treatment focus on patient's unique symptoms rather than generic disease labels. Like this patient has got this sort of a name, fancy names, what Hahnemann says, right? So he is not interested in that. Instead, there is an imbalance in the vital force, what Kent says. His work on miasms and constitutional approach of treatment enriched homeopathic disease theory. So, only after all these things, I hope he must have derived Kent repertory. What do you say? Right? Advocating that homeopathy not only advocates the symptom but also works to restore harmony and balance to the vital force, ultimately, which is the root cause of illness. So, James Taylor Kent, see his concept of disease. How sweet. So, hope this is my previous slide and two more slides, right? Be a little bit patient while studying organon of medicine, because fastness won't help. You should understand each and every concept of Hahnemann. Some key examples from his philosophy that reflects his approach of disease and healing. So really, on the topics. Totality of symptoms, what Ken says is the symptoms or the outward manifestation of the disease within. We must always look at the totality of the symptoms to understand the disease. Ma'am, where did you take all these sentences from? Kent lectures. Okay. So Kent philosophy. Please go refer these. Constitutional treatment, remedy which covers the entire state of the patient, including mental, emotional, and physical symptoms. Coming to miasms and chronic disease, greater cause of chronic disease and have to be dealt with their specific way, which is thought the administration of the correct homeopathic remedy. Mind-body connection, as I told you earlier, it is the key to understand the physical state of mind. What mental state? Coming to the individualization of treatment, each case of disease is unique. No two cases are identical. Therefore, the remedy must be individualized. That is the concept of disease condition by James Tyler Kent. So, disease classification and homeopathy, I need not explain you much. As you know, acute and chronic disease classification, aphorism 72, Hahnemann talks about acute diseases and chronic disease definition. Whoever asks you the definition of acute disease and chronic disease, always stick to aphorism 72. As we have got only less time, I'm not just going to the aphorisms, right? So hope you know those aphorisms. If not, if there is any doubt with Dr. Lavanya, you will have my number. Please contact her. Any doubt, you can call me, right? So, telling and talking about all these things, you should know the role of susceptibility and predispositions and disease manifestations, right? So, I'll talk about one aphorism regarding susceptibility, where aphorism 31, I hope so. Hahnemann talks about 30, 31, 32, 33, all those aphorisms regarding susceptibility. But what I wish to say about aphorism 31 here is the disease need conditions to act. Right? He talks about the susceptibility in aphorisms, where the inimical force is partly psychical and partly physical, to come with our terrestrial exposure is exposed. See, mark those words, morbific noxious agent, what Henneman calls it as disease. Please underline that. Morbific noxious agents, disease condition, do not possess the power of morbidly deranging the health of man unconditionally. Unconditionally is where I call disease a derangement of man's state of health. See his statement, how good it is, right? So it resembles to the susceptibility of the patient. But we are made ill by them only when our organism is sufficiently disposed and susceptible. Mark that word. Susceptible to the attack of the morbific cause. That is the disease condition that may be present. Hence, they do not produce disease in every one nor at all times. So, this beautiful aphorism 31 describes about the disease need conditions which has to be acted. So, role of susceptibility, you will have to identify and each disease concept. Understood? Yes. Coming to my conclusion, holistic understanding of disease is very important. So look for the dynamic imbalance in the vital force, each and every disease condition, and go for the importance of treating the patient as an individual, as a whole for true healing, which you call it as holistic, right? So with this, I end the concept of disease in homeopathy. I hope my class was not boring, and thank you for your patience listening. Any doubts you can ask me. Doctor, I have completed.
It's not boring, ma'am. It's overwhelming that we have got your sharing of the knowledge. It's very truthful and knowledgeable, ma'am. Respected participants, if there are any questions, you are welcome actually. Ma'am, there is a question, ma'am, from the participant.
Yes.
Is there any difference between vital force in man and dog? Elaborate it.
This is a good question actually, because nowadays veterinary homeopathy is being practiced, right? And we people follow the same principle, sticking to treating animals also. So in many of the seminars and conferences what I have attended, the similar law of similia is followed, sticking to the principle of Hahnemann. So vital force to each and every individual is different for animals as well as human beings, right? But we people follow the fundamental principles to animals. Okay, so Hahnemann has never said anywhere in the aphorism that this can be treated. But in his lesser writings of Hahnemann, where he talks about the rapid dog, so which was being affected with rabies. So how it is, how fearful it is. So you can see how he has related to the conditions of prescribing a drug. Okay, so you can have in UG, when you study lesser writings of Hahnemann, you will never find the concept of vital force. There is a difference. But in UG, you will find a difference.
Yes, ma'am. There is another question, ma'am. Ma'am, kindly explain what is the difference between surgical disease in aphorism 186 and surgical disease that comes under chronic disease in classification of disease.
186 and another aphorism he talks about.
And ma'am, they want to ask aphorism 186 surgical disease
Yes.
has been mentioned, ma'am.
Yes.
And the surgical disease that comes under chronic disease in classification of disease.
Yes. See, there is no much difference between the surgical disease, because you can stick to aphorism 186. Why? Because Hahnemann has classified that surgical disease only once in aphorism 186, right? So he, with the local melodies, okay, of external origin, explains about the surgical diseases. I just do explain to you as you have asked the doubt. He always says this surgical diseases. If surgery is necessary, patient can go for it. But he says what about it is reduction of dislocation, right? By needles by bandages to bring together the lip of the wound, mechanical pressure to still flow the blood of the open arteries, by the extraction of foreign bodies that have penetrated the living parts. So in this aphorism, he'll be talking about the 7 points regarding surgical diseases, where you can go right in the classification of disease too. Unless and until Hahnemann has explained about the surgical disease in aphorism 186, right? Because it is the classification of Hahnemann. Okay, there is not much difference. You can use this sort of one aphorism 186 there too. Okay, so finally he will end up by saying another 2 points, that external plane of scalded or burnt parts need to be homeopathically substituted that service of the dynamic physician. See how he explains. Physician is dynamic, so we have some magical powers in our hand, and his helpful homeopathy comes into requisition, right? So please think about it. 186 for surgical diseases. Okay. Any other questions? Doctor?
Yes, ma'am. I'm also waiting, ma'am. Is there any questions, participants, from your side? You're welcome, actually.
Doctor, please give my number to them if they are asking. And if any doubts regarding organon of medicine, according to my knowledge, I could a little bit clear their doubts.
Sure, ma'am. Sure, ma'am.
As it's already more time. So if there is any questions, please come forward.
I hope they have cleared every question, I think, ma'am.
Okay.
So coming on to the end note, sir, can we have the video, sir? Mohit, sir? Respected participants, there is an announcement here on the 12th January 2025. We're going to have an international Ayush conference and Ayush Youth Festival from the Aisha team in West Bengal, online as well as offline. I will be giving the updates in all our social media platforms. You can check out the updates over there. And regarding the certificates, everyone will get their respective certificates, as we have the limitation to only 100 people per day. So we appreciate your kindness and patience. So hope you understand our situation also, and kindly give us time. Yeah, thank you.
Thank you everyone for patience listening, and thank you for giving me this opportunity. Thank you.
Ma'am, one last question one has given, ma'am. Just answer.
Yes.
I would.
Yes.
In Materia Medica, in Aeschylus, it's given that lumbosacral backache is concomitant for rectal complaints. But concomitant means it does not have any anatomical and physiological relations. Can you please tell something about it?
Of course, go according to the symptom similarity. Okay. Not each and every case needs a detailed explanation. So wherever there is, like as I told you before, I do stick on sometimes with the characteristic symptoms, sometimes full totality of symptoms. So if you're not whether to stick on to the concomitant symptoms or to the specific symptoms, always go with the totality of symptoms. If it is an acute case, go for an acute totality and get a remedy. So Hahnemann is given an option of succession of antisorics also, right? So according to the acute totality, then or else if it is a chronic case, go for the chronic totality and follow up with the antisoric medicines, right? So that will be helpful in such sort of a cases. You need not worry about whether to follow this or that. Okay. Always stick to the Hahnemannian case taking at times.
Thank you, ma'am. Thank you so much. Thank you for your valuable time. Thank you all. Thank you, Team Asia. Thank you, our media partner, Homeo 360 Degrees. Thank you all. We'll welcome to the other session within a short span. Thank you.
Thank you.